brought a blanket. She laid down.
Good morning. I am Nicole Badmoccasin. I am the CHW in the Lincoln office. We're going to wait a few seconds to let people join in on our Facebook Live. Let's see. Today we will be talking with Dr. Bober and Dr. Fuller, and we have a little guest, Sugar.
Yeah, this is Sugar. She's going to give us some moral support. Even doctors need a little moral support when we talk about a tough subject.
Oh, yeah. And what kind of shirt does she have on?
Oh, she has her pumpkin shirt on. Let's see. Can you see it?
Oh, yeah.
That's her pumpkin shirt.
And on the back it says Mommy and Me.
Yeah.
Okay. So today we're going to be talking with Dr. Bober and Dr. Fuller about oral hygiene and oral cancer. Let's see. Dr. Bober is our director of our dental facilities, and she helps clinics along with our Dr. Fuller. Can you tell us about yourselves?
So I grew up in South Omaha, and actually I went to this clinic as a kid when it was called Prairie Clinic, and I graduated from South High right up the street. I worked for Omaha Public Schools for 22 years and then went into dentistry. And if you do the math, I'm only 39. And so I'm happy to be here.
Yeah. Dr. Fuller?
I am originally from Idaho. I went to Creighton for dental school. I've been working here for a little over 2 years. It's been great. I really enjoy it. Nebraska's been fun.
All right. So our topic is oral hygiene and oral cancer. You want to start with oral hygiene, or?
So the subject we're going to talk about, we're going to focus a little bit more on oral cancer.
Okay.
At the oral hygiene visit, you get an oral cancer exam.
Okay.
So we thought we'd just start at that point
Okay.
because it's a serious
Issue.
yeah.
Yeah,
Mhm.
it's a serious subject. So when you come in for your cleaning, we usually do an exam. The hygienist can do it, or a dentist can do it. We basically want to see what's going on in the oral cavity. So this is our chance to really delve in. When you go to get your physical, like with the physician, they might stick a tongue depressor in, have you stick your tongue out, maybe check out your tonsils and maybe the top of the tongue. But since it's our area of expertise, we like to kind of delve in a little more. So we'll kind of peel back the cheeks, the lips, we'll look at the underside of the tongue as well as the sides of the tongue. We can check out the tonsils as well, the palate or the roof of the mouth, and anything underneath the tongue, kind of by the teeth almost. Check for anything that looks abnormal. We'll also check underneath your jaw for any lumps or bumps, and you may have noticed them or you may have not, so we do like to ask you if you've noticed anything abnormal lumps and bumps wise. You can always kind of check out underneath your jaw yourself too. If something's been there for a long time, that's usually not a great sign. So we like to ask those questions as well.
So most of what we see is not scary. You know, just like our new skin, you might have little lumps and bumps that are nothing. But we do want to see if there is anything of concern because we're going to refer you. But here's a situation that came up a couple weeks ago. We had a patient call, and she said she had a sore in her mouth. We haven't seen this patient in a couple years. We got her in right away. And so the first thing she does is tells us where the sore is at. And she called in too because it was painful. It was so painful that she wanted to be seen.
Yeah.
So the first thing we do is we start our detective work. We're like the forensics of dentistry. So we can't see under the gum tissue, so we take an x-ray. And then, because we can't see it with our naked eye. And then the next thing is we look in there at it. And we look to see where it's at. There's tissue that's movable or that is attached, believe it or not. And if you think about it, there is different tissue in your mouth because when you eat or drink coffee, hot coffee, the top of your roof of your mouth has to be tough, where other tissues aren't so tough. Want to try it, Doc?
Yep.
'Cause I gotta move her.
So we'll also look for other things that we can see like clinically, so not just on the x-ray, but if it's like a bump or an ulcer or a cut or a laceration, we want to note that. Also like the color of the area, is it red, is it white, is it red and white? How long has it been there? Has the patient noticed it? Is it painful or not? Those are all things we kind of like to know. We might even take a picture of the lesion just to kind of monitor it if it's been there for a while, or to watch for any changes. If it gets smaller, if it gets larger, if it starts to look different, things like that can be really helpful too.
So next we look for possible causes. Like, why did they have this sore in the mouth? Sometimes it's due to medications. Different medications cause different sores in the mouth. Sometimes it's food. Around Super Bowl time, people get popcorn cuts and popcorn holes stuck all over their mouth, and they'll come in, and then we'll ask them, oh, did you just go to a Super Bowl party? Sometimes it could be hot sauce or tomato sauce. That'll make the taste buds at the tip of your tongue get enlarged and feel on fire. And let me see here. I'll let Dr. Fuller talk about her experience.
Yeah, so like one time I went to the dentist just for a cleaning, right? So the hygienist is looking in my mouth, and she noticed ulceration on my palate. I actually just had like a tortilla chip like 2 days earlier and stabbed myself in the mouth with it. So that's kind of where that ends, right? So there's a cause to the lesion that she sees in my mouth, so that makes sense. And then of course that healed up normally. Another food that actually can cause a lot of problems is like hot pizza or like a hot pocket or something. It can like burn the palate, so that's really uncomfortable and can cause like some ulcerations as well.
Yeah, that cheese is pretty sticky.
Yeah.
Sometimes, and it was in this patient's case, her denture was rubbing, her partial was rubbing. But we really don't know exactly at first what's causing it, so we gotta look at the underside of the denture. Sometimes we'll put a little paint under there. The paint's like Crisco with a little brush, and then when you seat it down where it's touching and rubbing, it'll wipe away the Crisco, and then you can see it and we'll touch it and we'll say, oh, is it right there? And so then we know the exact spot to adjust on the denture. And trauma, like Doc mentioned, sometimes viruses. The other thing that's real concerning is if the patient has cancer already, you know, breast cancer, other cancers that metastasize. So their medical history really plays a part. So being the detective, you gotta look at everything. You can't just assume by the phone call. And most of the time, I would say we come up with a reasonable diagnosis. And
Yep, so then at that time, if we can determine the cause of the lesion, then we can go ahead and think about how we can fix it. Like Dr. Bober mentioned, if it's like a denture or a partial that's not fitting super well, we can adjust that usually. Maybe it's not fitting well at all, they need a whole new denture or partial, that's a possibility. If it's something like a popcorn hole, we can go ahead and try to remove that. If it's like the hot sauce or some other acidic foods, obviously we'd recommend stopping consuming those to get rid of that problem. If it's a medication, we can chat with the physician usually and see if we can make some changes there. Sometimes we can, sometimes we can't. Most normal things like the tortilla chip to the roof of my mouth would heal in 10 days. If it's not healing, that's a little more concerning. We'd want to see you back. Small things that don't look super suspicious to us, we can usually remove and biopsy ourselves. Sometimes we do have to refer to the oral surgeon or ENT. it shouldn't be something you should be scared of if we refer you. It's just maybe an area that's harder to biopsy, or we would like someone else to take a look at it, kind of as another peace of mind for both us and the patient.
Yeah, and the reality is, unfortunately, some patients do get cancer. And so the key, like with any cancers, is to catch it early. I did a rotation at the med center while in dental school in oral cancer. And a sad story that happened was one of the physicians there, he brought in his uncle, who was probably about 80 years old. And it started off that his uncle had a little sore in his mouth, and he thought it was nothing. And then when it got bigger, he was scared, and so he didn't do anything about it. He was too scared. And unfortunately, by the time we seen him at the med center and his nephew brought him in, it was pretty progressed. So we do like to see people, even edentulous, because we like to bring them in and look at their tissue, even though they don't have teeth, we still like to see them.
Definitely, yeah. And then there are some risk factors, obviously, that increase your chances of getting oral cancer. Tobacco use, whether you're smoking it or chewing it. If you're chewing it, there's those little glass particles in some of the chew that can irritate the tissues and cause some problems too. Alcohol use, diabetes can cause changes in the tissues. Can also sometimes make your teeth loose if you're not coming in regularly, so that's kind of another subject. Obviously, it's if that diabetes is uncontrolled or managed poorly. Drug use, ill-fitting dentures can cause problems if they're constantly rubbing and causing chronic lesions or issues like that. And then sometimes, unfortunately, people are just predisposed to getting cancer.
So I think there's many things that dentists and physicians have in common, but one thing is, if we don't hear from a patient, we think they're doing well. You know, so if there is a concern, feel free to call us. Nicole, do you have any thoughts or questions?
Yes, I do. Okay, so if you have any questions on Facebook Live, just please keep it kind of okay. We don't follow the HIPAA guidelines on Facebook. You can just put your questions and we'll try to get back to you. Are there many different types of oral cancer that somebody can get? Or is it just like one type?
Well, if you ever stopped in the dental clinic, we have 2 books, each one about this thick. One's for soft tissue cancer and the other one's for bone cancer.
Yeah.
So there are tons of cancers you wouldn't believe it, different types.
Just for the oral?
Well, sometimes they could be the same, like squamous cell.
Yeah, they're like skin, usually skin or bone, so obviously you have skin and bone throughout the whole body, so they're not just, what is the word I'm looking for?
Specialized.
Yes, yeah, exclusive to like the oral cavity usually, but yeah, it's a vast number.
Okay, and so do you find that the oral cancer, does it progress fast, like in some people, or?
It depends on the type, right?
Yeah, I had a patient once in private practice that came in with bad headaches. And the thing you have to be careful about, or we have to be careful about as dentists, is we don't really want to start taking out teeth or doing root canals. And it doesn't, you know, if it doesn't relieve the patient's discomfort, you really need to look deeper.
Yeah.
So in this patient, she had come into us because she had some teeth taken out, root canals, and you could feel the tumor in her cheek. So when we did some research, she had breast cancer. So sometimes, just like other parts of the body, it can progress fast or slow. And so that's why we look, or the hygienist Kathy looks. Yeah.
So is oral cancer genetic and is it contagious to others? Like, kissing was and.
Genetic, there has to be some sort of genetic disposition, or you're using drugs or alcohol or any of those risk factors that we were talking about earlier. Contagious? No.
No, it's not. That's a good question though, because even years ago,
Yeah.
people were worried about cancers being contagious.
And so, do they have like vaccines for oral cancer that you know of, or?
One type of cancer we might see in the mouth is human papillary cancer. And so they are vaccinating younger people for it. And so then it does decrease the cancers in the mouth. Coming regularly to the dentist is probably the best vaccine. Yeah, and doing self-checks. You know, like Dr. Fuller mentioned at the beginning is, you know, as a woman, I do a breast cancer exam at home in the shower. So people, when they're brushing their teeth, can look around and see if they see anything that they might not have noticed before.
Let's see. And who's more prone to get it? Does it matter what age, or besides their background health?
You know, that's an interesting question.
Yeah.
In dental school, certain lesions, whether they're not cancerous or not, some of them were a 40-year-old black person, female. Like, you had to know the preliminary sex, age, and where it's located at. Like, there's a cyst you'll see between the two front teeth, and it happened during development when the two parts of the body met and they trapped a little tissue. So we might see that there. It's something most people get when they're young. So that's kind of a broad question too. Yeah.
And can this really be fatal if they're not, like you said, if they're not taking care of themselves or not checking up with the dentist?
Unfortunately, I've had patients pass away from it. Just like any cancers, you know, they're more and more survivable. I will tell you, over at the Med Center, they do remarkable things. And I say the cancers in the jawbone, they might take a rib and put up there and put implants in there. We have a patient that has that. They do different things, but it's a tough one because it affects how you eat and how you drink, how you look, whether or not people hire you. You know, your smiles and your teeth make a big difference.
Oh yeah. What would you say your biggest challenges are as you face as a dentist with your patients?
In respect to oral cancer, to start with, first of all, I think it's compliance, getting in. I've had a patient who I was pretty sure had some scary lesion in the neck, and trying to get them to go in sometimes is years, and then it's too late. That's probably, we have a couple patients that we encourage, because we don't know. We don't know for sure, and we just, and then the next thing is, we're fortunate here because UNMC takes our referrals.
Agreed.
Yeah, and Helen, who most people know from the front desk, she has relationships with the offices we refer to. So usually she can help us get a patient in, maybe a little early. Sometimes there's a financial component. We have used the medical referral.
Yep, that's
If-
helpful.
Yeah. So I think the problem is putting together the package. You know, getting the patient to go, getting the appointment, getting called. You know, they'll check their resources.
Okay, so we touched on the cancer. What about oral hygiene?
So that's a good question because most people think there's one type of cleaning. They'll call in and say they want a cleaning. So we have 3 or 4 different types of cleanings, based on bone loss, whether or not they have tartar. It's kind of funny, in dentistry we call it calculus. Calculus is what I took in high school or college, but yeah, so some of those cleanings take up to 4 appointments. They numb up a section if it's really bad, so they can get it all off. The bad thing about tartar, it causes bone loss. So, as dentists, when we go to the store and we see people smile, they might be missing the 4 little teeth down here. And you think, why? Because they're probably the easiest to clean, but there's the juice in your mouth comes from little glands under your tongue, and that juice is full of proteins and bacteria, and they build up right there. So even us, we have to go to a hygienist and get a professional cleaning.
Absolutely.
Yeah.
Let's see. How often would you recommend people to go in for dental exam and cleanings?
Yes, so that also depends on the type of cleaning you're getting and how much tartar buildup you have. So it's a little different for everyone. It's not like a set in stone every 6 months for everyone. It's kind of something we tailor to each patient individually when we see them for their first exam. At least, I think everyone at least should come in every year. That's normally when we take x-rays, is every year. I don't even know if I can get away with going once a year.
Yeah.
But at the very least.
Yeah. Now, if they have braces, usually it's young people, sometimes adults, it is horrible to clean around those wires. And so you really want to do that, because we've seen some cases where people have gotten braces and they take them off and their teeth are almost destroyed.
Not good, no.
And you kind of get them for a couple reasons. One's for function and the other one is to get a good smile. And so when you take them off and they don't look good, so a lot of times I'll tell them, hey, let's try and get you in once a month so we can help you and it keeps the tissue. I've actually had to, on a couple younger people, gone in and trimmed the tissue down, because when that tissue isn't cleaned, it actually grows up next to the braces and then they can't clean it at all. Yeah, so we like to have them have a clean.
What would be a good oral hygiene regime be for someone?
Yeah, so also we would tailor that to the specific patient's needs, like during the exam and stuff, so that depends also on the type of cleaning. But maybe generally speaking, for like an adolescent or an adult, you need to brush your teeth 2 times a day at least for 2 minutes, with toothpaste with fluoride in it, please. The other toothpaste doesn't work very well, I've seen that several times. Flossing 1 time daily, obviously if you want to do it 2 times, that's wonderful. I really like the Act mouthwash too. That mouthwash never hurts anything. So generally that's just a basic for everyone type of a routine.
And why Doc likes Act is because it has fluoride in it.
Yeah.
Fluoride's our friend in dentistry. You know, if you really want to keep your teeth a long time, you floss them. Yeah.
Awesome.
Yeah.
Let's see. What for kids? What age would you recommend them start seeing a dentist?
Well, I like to see them when they get their first tooth or 1 year old. Now, there's not a whole lot we as dentists do to a 1-year-old in the dental chair, but what it's good for is for educating the parents, the caregivers, on how to take care of these teeth. It used to be, I'll call it in the old days, they would see their first patient around 7 or 8, but they were coming in with cavities. So then they wanted to have exams before they started kindergarten or first grade. Well, they were still having cavities. And then Head Start, wanted them to have an exam between age 2 and 3 they were still having cavities. So we like to get them in at age 1 or their first tooth so that we can tell the parents how to avoid all that.
All right. Let's see.
Those are all good questions. Yeah.
So, what are cavity fighting sealants that
Good question.
So sealants are something that we place in like deep grooves of teeth to prevent food or other debris from kind of sitting in the area. If it sits in the area, it can cause a cavity. So sealants kind of make the tooth a little more smooth, so things can't get caught down in the areas and form cavities. So they're kind of a preventive measure.
I don't know if you caught what Dr. Fuller just said, but she said food in the grooves. The misconception is that sugar causes cavities, but how you get a cavity is you have bacteria all over your skin, hence you have bacteria in your mouth, and those little guys metabolize carbohydrates. So it could be drinks, or it could be a cookie or bread, or chips eventually turn into carbohydrates, which break down to sugars. But when the bacteria metabolize that, they produce an acid. And the acid's the one thing that can destroy your teeth. If you suck on lemons, it'll destroy that enamel. If you don't get the food off and the bacteria metabolize that and produce, like a little factory, they produce acid, that'll make holes in your teeth. And then the food gets caught down in there deeper. Unfortunately, if you have a 13-year-old who's bulimic and wants to stay thin, so vomits her food or his food, then that stomach acid will eat away the enamel on the inside. Other than that, that enamel is the strongest substance in your body. Yeah.
Okay, let's see. Do we have any questions from our Facebook audience? Anybody have any questions they would like to ask? Jessica, any questions you have? All right. I know you talked about fluoride. What is fluoride, and why is it important, like, for your dental health?
So fluoride is like an element. It's in drinking water usually, unless you have well water, then it's usually not present. But it remineralizes teeth. So when they get the enamel, like Dr. Bober was talking about, can get a little soft sometimes. As long as it's not cavitated, like a cavity is starting, fluoride can go in and kind of bind to the enamel and strengthen it.
Can one person get too much fluoride?
Yes, you can have too much fluoride. Usually that's only a concern in pregnant women or small children when their teeth are developing. I think you can, well, I guess you can.
It's more of an ingestion thing
Yeah.
too.
Right.
Now, the only place I've ever seen it a problem is when I worked at One World and some of the patients were from Mexico, Durango, that area. For some reason, they had tons of fluoride because it is a natural element, and then you would see speckly brown teeth. Yeah,
But they're hard as rocks.
yeah,
Really?
Yeah,
Yeah.
they're really strong.
yeah,
They usually don't get cavities, but they don't look very pretty.
yeah.
Oh my goodness. Let's see. What would you recommend to keep people's teeth whiter? Besides, do you go in for cleaning? I mean, do they whiten them? Besides brushing and flossing?
That's an interesting one. There's a lot of things that cause stain on teeth.
Mhm.
So sometimes if you have stain from like coffee or something like that, Cleanings can help because they remove the stain, the hygienist will. So a lot of people complain of sensitivity with their teeth. If I ask them what toothpaste they're using, they tell me a whitening toothpaste. So whitening toothpaste have like little abrasive particles in them. And if you have sensitive teeth, that actually makes it worse, because if you think about it, you're kind of scrubbing your teeth with like baking soda or something like that that's like a little erosive. So that's kind of meant to, I don't want to say wear down your enamel, but it can wear it down. So whitening's kind of a slippery slope, I guess. Having white teeth isn't necessarily better than having healthy, pain-free, not sensitive teeth.
So, for patients who have come and got their exam, all their work done, and they're a good candidate, we do offer bleaching. And so, there's a charge for it, and it can cause sensitivity. Me and Dr. Fuller, am I speaking for you?
No.
Personally, don't like white chiclet teeth, because the tooth naturally isn't like that, and sometimes it just doesn't look natural.
Yeah.
So we don't mind somebody wanting to whiten their teeth, but there is kind of a line that we worry about if it's, because it's bleach. It's a bleach that can go in your mouth. Don't use bleach over the counter. Yeah.
Okay, we have a question from one of our Facebook viewers. It says, what can you do with someone who grinds their teeth at night? What can they do to prevent tooth decay and cavities?
I think those are two different things. So as far as the grinding goes, that can be related to stress, so that's kind of something we want to figure out why the person's grinding too. Mouth guards can be useful with grinding. As for the cavities, I think it's just having a good oral hygiene routine, brushing, flossing, maybe throwing in a mouthwash, and then visiting us regularly for cleanings and x-rays so we can catch any cavities small. If something's hurting, it's usually not a small cavity we can fix with a filling. So definitely coming in regularly so we can catch things small.
So grinding is something like oral cancer. You want to catch it early and start treating it. Because unfortunately, we do have some patients that have worn their teeth down to nubs. You know, so we don't like that. If you have grinding with children, like a 5-year-old, usually it's kind of what, an adenoid tonsil problem? Yeah, airway problem, so we'd send them to the ENT.
Okay, do we have any more questions? One more question? Let's see. Okay, so we have one. I have dentures that are too short. Can you add teeth to it, I guess? Add on to the dentures.
That sounds like it might be worn down maybe. Maybe it's a worn down denture. So we probably have to make a new one.
Yeah,
Increase anything.
yeah. It depends on the space. If you think about it, people open like alligators. So you gain a lot of room in the front, but you might not gain much room in the back, depending on the hinge. So sometimes they can't put teeth in a denture back there. I think the best thing is to look at it. We might have a solution.
Okay. Any other questions from our Facebook family? All right, anything else you?
No, we appreciate the time.
Yeah, thank you. Okay, I just want to thank Dr. Fuller and Dr. Bober for joining us today on our Facebook Live. If you have any other questions, please email Nancy Vasquez. We'll get back to you on those. I'd like to thank you guys for coming in and talking with us. And Sugar.
Yeah. Thank you.
Yeah, thank you. And join us on Wednesdays for our mental health videos. And on May 4th is our MMIW, Murdered and Missing Indigenous Women Facebook. Have a good day.
All right, thank you.